Hello everyone. In today's session, we'll be learning about the stomach and the spleen. Okay, in previous sessions, we had learned about the anterior abdominal wall, rectus sheath, inguinal canal. Okay, make sure you all watch those videos if you have not seen yet. Okay, and in abdominal organs, stomach is a very important topic in which you all can expect a long answer question. Okay, usually a 10 marks question is asked on this topic. Okay, and spleen is also an important topic. Okay, both of them will be learning now. So let's start with the stomach. So like we had made notes for other regions, there are notes for stomach as well. Okay. So stomach is an organ which is located in the left hypochondriac, umbilical as well as epigastric region. Okay. In the abdominal wall, we had learned there are 9 quadrants of the abdomen, right? So stomach occupies these quadrants. Okay. Capacity of stomach is around 30 ml at birth. At puberty, it is 1000 ml, and in adults, it is 1.5 to 2 liters. Okay. It has got tremendous capacity to expand as well. Okay. Then morphology of stomach means the external features of the stomach. Shape is referred to as J-shaped organ. Okay, in this image we can understand the shape. Okay, it's like a J-shaped organ. Then length is around 25 centimeters, and it has got two ends. Those are referred to as cardiac end and the pyloric end. Okay, so this one is the cardiac end and this is the pyloric end of the stomach. It has got two curvatures, lesser curvature and greater curvature. Okay, so this one is the lesser curvature, and on the outer aspect, that's the greater curvature. Okay, then there are two surfaces, antero-superior surface and postero-inferior surface. Okay, the anatomical position of stomach is such that the anterior surface is not only anterior, it is little bit superior as well. Okay, that's why it is referred to as antero-superior surface, and posterior surface is referred to as postero-inferior surface. Okay, then there are further parts of the stomach. There is a cardiac part, fundus, body, pyloric part. Okay, so here we can see fundus, body, and there is a pyloric part which includes the pyloric antrum, pyloric canal, and the pylorus. Pylorus is a thick muscle coat which is present here. Okay, then relations of the stomach. On the lesser curvature of the stomach, there is a fold of peritoneum that is referred to as lesser omentum. Okay, here we can see there is a fold of peritoneum which comes from liver to the stomach that is referred to as lesser omentum. Okay, then on the greater curvature, there is an omentum called as greater omentum. Okay, so these folds of peritoneum, they cover the stomach and they extend from the greater curvature as well, where it is referred to as greater omentum. Okay, then from stomach to spleen, there is a fold of peritoneum called as gastrosplenic ligament. From stomach to the diaphragm, there is a fold of peritoneum called as gastrophrenic ligament. Okay, then visceral relations, which organs are related. So anteriorly, there is left lobe of the liver, there is diaphragm, there is rib cage, and the anterior abdominal wall. Okay, and posterior relations of the stomach are referred to as stomach bed. Okay, there is a separate image for that in the next page, we'll see in some time. Okay, and separately, stomach bed is also asked as a question for you all. You should know what structures are included in stomach bed. Okay, and then interior of the stomach has got gastric rugae. Okay, there are multiple folds, those are referred to as rugae. Okay, see in this image we can see multiple folds in the interior of the stomach, that is referred to as gastric rugae. And then there are some pits called as gastric pits, the gastric glands which open on the surface. They have minute openings called as gastric pits. And there is gastric canal of Magenstresse. At the level of the lesser curvature of the stomach, on the inner aspect, there is a canal in which rugae is very less. Okay, it is like a canal through which fluids can pass through it, that is referred to as gastric canal. Okay, then blood supply of stomach, there are many vessels supplying it. So they are left gastric artery, right gastric artery, splenic artery, left gastroepiploic artery, right gastroepiploic artery, short gastric arteries. Okay, there are many arteries, but chief artery is this celiac trunk which will give these branches. Okay, details we'll see in image which is there in the next page. Okay, veins, they follow the arteries but they drain into the portal vein. Okay, the nerve supply of the stomach, sympathetic nerve supply is T6 to T10 spinal segments, which is vasomotor. That means it will constrict the vessels. It is motor to the pyloric sphincter and inhibitory to the remaining gastric musculature. Okay, parasympathetic nerve supply is by the vagus nerve. There are two vagal trunks, anterior vagal trunk and posterior vagal trunk. Okay, then lymphatic drainage also, there is a diagram that we'll be seeing. Okay, and there are multiple applied anatomy related with the stomach. Let's see them. Gastric ulcers, also referred to as peptic ulcers, it occurs along the lesser curvature of the stomach due to the break in the continuity of the mucous lining. They are usually caused by hyperacidity and anti-inflammatory drugs. Okay. Then gastric cancer, it occurs in the region of pyloric antrum along the greater curvature of the stomach. Okay. Gastric cancer spreads by the lymph vessels through the left supraclavicular lymph nodes. And the enlarged palpable left supraclavicular lymph nodes is also referred to as Burkhoff's node, and it is usually the first sign of gastric cancer, also referred to as Troisier's sign. Okay. Then endoscopic examination is done for the interior of the stomach. Okay, it can be directly examined by an endoscope. Then there is a space called as Trobes space. It is a topographical area overlying the fundus of the stomach. Okay, fundus of the stomach can be demarcated on the outer surface. Usually there is a gas present in the fundus of the stomach, and it will have a tympanic note on percussion. Okay, it is bounded superiorly by the lower border of the left lung, inferiorly by the left costal margin. On the left side there is spleen, and on the right side there is lower border of the left lobe of the liver. Okay, all these structures are bounding the Trobes space. And there is a triangle called as gastric triangle. It's an area which is in contact with the anterior abdominal wall. Okay, it is bounded on the left side by the left costal margin, on the right side by the lower border of liver, and inferiorly by the transverse colon. Okay, so why this is important? If there is any obstruction of the esophagus, gastrostomy can be performed in this area to feed the patient. Okay, so these were various applied anatomy related with the stomach. Now let us see some diagrams which you all can draw during the exams. Okay, we can draw diagrams of different parts of the stomach. This diagram shows the blood supply of the stomach. Okay, CT stands for the celiac trunk, which gives an artery called as the splenic artery, the left gastric artery, the common hepatic artery, and from the common hepatic artery there is hepatic artery proper. Okay, and we can see the right gastric artery coming from here. Then an artery goes down, that's referred to as gastroduodenal artery, which is giving a branch called as right gastroepiploic artery. From the splenic artery there is left gastroepiploic artery. So all these were the vessels which we had seen in the blood supply of the stomach. Okay, so this diagram you have to practice for blood supply of the stomach. Okay, then this image shows the stomach bed. So these are the posterior relations of the stomach. Okay, so see which structures are forming the posterior relations. There is diaphragm, there is spleen, left kidney, left suprarenal gland, left colic flexure, splenic artery, transverse mesocolon, body of the pancreas. Okay, so there are many structures which form the stomach bed, and they are also referred to as the posterior relations of the stomach. Okay, and this image shows the venous drainage of the stomach. So veins correspond to the arteries, and ultimately it drains into the portal vein. Okay, and then there is a diagram for lymphatic drainage of the stomach. Look at this diagram. So in lymphatic drainage you can just draw the shape of the stomach and draw 4 quadrants like this and number it properly: 1, 2, 3 and 4. Okay, and from different areas there are different lymph nodes which are mentioned. Okay, and ultimate lymphatic drainage, it will go to the celiac group of lymph nodes. Okay, chief artery was also the celiac trunk, chief lymph node is also celiac group of lymph nodes. Okay, and there was one applied anatomy related to it. The gastric cancer spreads through the lymphatics. Okay, and from the celiac lymph nodes it can go up from the thoracic duct and towards the left supraclavicular lymph nodes, referred to as Troisier's sign, right? Then this image shows the anterior vagal trunk and the posterior vagal trunk. Okay, these were for the nerve supply of the stomach. Okay, there are multiple branches which are there. Okay, and in olden days there was a surgery performed called as vagotomy, in which these vagus nerves used to be cut to relief of peptic ulcer. Okay, but nowadays medicines work well, so vagotomy is nowadays not performed. Okay, so this was about the stomach. Let's move on to the next organ. Yes, this one is the spleen. Okay, so spleen, where is it located? It is a hemolymphoid organ located in the left hypochondriac region. Okay, on the left side. And to understand the external features of spleen, there is a dictum called as Harris dictum. Okay, it is a dictum of odd numbers: 1, 3, 5, 7, 9, 11. All are odd numbers. Okay, so what is one spleen is 1 inches in thickness. 3 is spleen is 3 inches in breadth. Spleen is 5 inches in length. Okay, if you see the spleen here, so length would be like this. Okay, anterior-posterior length would be around 5 inches. Breadth is 3 inches. Okay, and thickness is 1 inch. Okay, 7 ounces weight, approx 200 grams, and extends from 9th rib to the 11th rib. Okay, as we can see here, this is the 9th rib, this is the 11th rib. Spleen extends between these ribs. Okay, then morphology of the spleen, it has got two ends called as the anterior end and posterior end. In this image we can see this is the anterior end, that's the posterior end. Okay, then there are three borders: superior border, inferior border, and intermediate border. Okay, this one is the superior border, this is the inferior border, and this is the intermediate border. Okay, then there are two surfaces: diaphragmatic surface and visceral surface. Okay, this surface that we can see, that's the visceral surface. There is one surface towards the diaphragm, that is the diaphragmatic surface. Okay, in this image we can understand one is diaphragmatic surface, other is the visceral surface. Okay, so there are multiple relations of the visceral surface. Let's see that it is related with the fundus of the stomach. Okay, so look at this gastric impression which is mentioned, that's for the fundus of the stomach. Okay, so this is for the stomach. This area is for the left kidney. Renal impression is for the left kidney. Then there is this area for the splenic flexure of the colon. Okay, and at the hilum of the spleen there is tail of the pancreas. Okay, so all these organs are related in the visceral surface of the spleen. Okay, fundus of the stomach, left kidney, left colic flexure, and tail of pancreas. Then there are peritoneal relations of the spleen. In the stomach also we had learned this fold, gastrosplenic ligament. Okay, extends from the hilum of the spleen to the upper one third of greater curvature of the stomach. It contains the short gastric vessels. Then linorenal ligament, it extends from the hilum of the spleen to the anterior surface of left kidney. Then there is a ligament called as phrenico-colic ligament. Phrenic refers to the diaphragm, colic refers to the colon. Okay, so this ligament is actually not attached to the spleen, but it supports the spleen from the anterior aspect. Okay, so for peritoneal folds, look at this diagram. Okay, there is a ligament called as gastrosplenic ligament, this one which is having short gastric arteries, and from the spleen to the kidneys, linorenal ligament. It contains the splenic artery and the tail of the pancreas. Okay, and blood supply of the spleen is by the splenic artery, the largest branch from the celiac trunk. It has a tortuous course. Tortuous means it will have like foldings like this. Okay, and venous drainage of the spleen is by the splenic vein. Okay, and at the level of neck of the pancreas, splenic vein joins with the superior mesenteric vein to form the portal vein. Okay, the nerve supply of the spleen, sympathetic, is by the celiac plexus. It supplies the blood vessels, that is vasomotor, as well as the smooth muscle fibers in the trabeculae and the capsule. Okay, and parasympathetic nerve supplies by the vagus nerve. And lymphatic drainage of the spleen. Spleen itself is a lymphoid organ, so splenic tissue itself is not having any lymphatics, but there are some lymphatics from the capsule and the trabeculae of the spleen that drain into the pancreatico-renal lymph nodes. Okay, then applied anatomy of spleen. Spleen can be palpated if it is enlarged in size. Okay, normally it is not palpable. When it is enlarged more than double of the size, it becomes palpable near the left costal margin during deep inspiration. Okay, then splenomegaly is the enlargement of the spleen. The common causes are malaria, cirrhosis of liver, chronic myeloid leukemia, Kala Azar. These are clinical conditions, okay, in which spleen is enlarged. Then rupture of the spleen. If there is a trauma in the abdomen, spleen is the most common organ to get ruptured. Okay, most frequently organ ruptured following an external blow at the left upper abdomen or at the left lower chest. Then there is a sign called as Kerr's sign. If there is splenic rupture, blood gets accumulated surrounding the spleen and it irritates the left dome of the diaphragm, and pain of it is referred to the left shoulder because there is the same root value which supplies the diaphragm and the left shoulder. Okay, so that sign is referred to as Kerr's sign. Okay, C3, C4 are the root values which supply the diaphragm as well as the left shoulder. Okay, then splenectomy means removal of the spleen surgically. Okay, it is performed when the spleen is ruptured or in certain blood diseases. Okay, and while removal of the spleen, tail of the pancreas should be preserved very carefully. Okay, as we can see, the tail of the pancreas is related with the spleen, and the tail of the pancreas contains maximum number of islets of Langerhans. If in case this is damaged, then it may lead to iatrogenic diabetes mellitus. Okay, iatrogenic means diabetes which is induced by some medical procedures. Okay, so this was about the spleen, and there are some diagrams which you all can practice. Arterial supply of the spleen artery, we know the splenic artery, it is a branch from the celiac trunk. Okay, then venous drainage of the spleen is by the splenic vein, which unites with the superior mesenteric vein to form the portal vein, and this union occurs behind the neck of the pancreas. Okay, and this image we can see the phrenicocholic ligament. Phrenic refers to the diaphragm. Okay, from the diaphragm to the colon. Okay, this is the phrenicocholic ligament which supports the spleen. Then this image shows Kerr's sign. Okay, Kerr's sign is if there is any splenic enlargement or if there is rupture of the spleen which irritates the left dome of the diaphragm, that pain can be felt at the tip of the left shoulder, that is referred to as Kerr's sign. Okay, so like this, both spleen and stomach we have covered in a quick revision table. Okay, make sure you all access these notes from the QR code which is seen on this screen. Okay, many other notes we have made for upper limb and lower limb, even hard copies we have made available. Make sure you all buy them and it will definitely benefit you all. Okay, thank you.